In this module, we will discuss how to create inclusive research using participatory approaches. In the last module, we learned about what research is and how the history of autism research has sometimes led to biased, harmful, and ineffective supports for autistic people. In this module, we will learn about how to include the community in the research process to help correct these biases. This inclusive approach to research can be called a participatory approach. In this module, we will learn 1. What is participatory research? 2. The importance of centering the experiences of autistic people and caregivers. 3. Using inclusive language and framing. And 4. Community-driven relevant research. Section 1. What is participatory research? In this section, we will discuss what participatory research is, why we need it, and the different levels of participation. We'll also discuss some principles that researchers must keep in mind when working with community members. Participatory research is when researchers work with members of the community affected by the research. The community participates in creating research. An example of this would be if a researcher works with autistic people to create a research study about autism. Participatory research puts the wants and needs of the community members first. It values the opinions and experiences of the community. Participatory research can be done in a lot of different ways, but there are some guidelines researchers should follow to make sure community partners are treated fairly. We'll talk about those guidelines later in this section. There are also many terms to describe this kind of research. Some terms include participatory action research, community-based participatory research, stakeholder-engaged research, community-engaged research, and more. Community members are people who are directly impacted by the outcomes of research. Another term for this is stakeholders. Here are some examples of community members in autism research. Autistic people, because they receive therapies. Caregivers, because they make decisions for their child and are part of the therapy team. Clinicians, because they deliver therapy and help families make decisions. Policymakers, because they decide which services get funded. We will focus on autistic people and caregivers in these modules. This also includes autistic caregivers. Community participation is needed for many reasons. Community members can make sure that research methods are ethical and inclusive. They also make sure that researchers are studying therapies and skills that are important to the community. Community members help researchers understand their findings better, and this can help to shape future research and clinical care in a way that best suits the needs and preferences of the community. Community members should be involved in every step of the research process, but autistic people and family members have said that they were unhappy with their involvement in research for a few reasons. They said that they didn't understand what researchers wanted them to do. They also said that researchers didn't value their opinion. This shows that researchers may need to partner with community members more closely. There are different ways that community members can participate in research, but they should be involved as much as possible. This framework by Goodman and Thompson describes 3 levels of participation. It ranks the levels from least participation to most participation. There are 3 levels of participation that we'll go over in the next few slides: non-participation, symbolic participation, and engaged participation. The lowest level is non-participation. Non-participation means that researchers learn how to reach community members and educate them about research topics. There are a couple of advantages to non-participation. At this level, researchers might contact the community to teach them about their research or recruit community members for studies. but the community is not involved in creating research. The advantages to non-participation are mainly for the researcher. Next is symbolic participation. At this level, researchers ask community members for feedback and help with their research studies. The biggest advantage of symbolic participation is that the research will be more relevant to the community's preferences and values. But the community does not carry out the study and may not have decision-making authority. So, researchers ask community members for advice, but they don't necessarily listen to what community members suggest. Finally, there is engaged participation. At this level, researchers and community members work together to create research focusing on community preferences. In this approach, community members have decision-making authority and their ideas take priority. Researchers support community members' ideas and teach them about how to conduct research. Researchers should always aim for this level of participation when possible. The drawback to this level of participation is that it requires a lot of time and resources. It's vital to have autistic people and caregivers in active leadership roles in the research process. Specifically, we must ensure that community members from historically underrepresented groups are involved and prioritized as well. There are many things that researchers must do to ensure that community members contribute to research in comfortable, satisfying, and equitable ways. We'll review these principles in the next few slides. First is reciprocal relationships, where researchers and community members decide on roles and decision-making authority together. Co-learning means that researchers should teach community members about the research process, prioritize community participation during the research process, and commit to incorporating community preferences and priorities. Partnership means that research teams value the contributions of all community members equally, honor their partners' other time commitments, and commit to diversity in their partnerships. They should also compensate partners for their efforts whenever possible. Transparency, honesty, and trust mean that researchers are clear, share information, and are open with their partners. They should spend time building trust with their community partners so that partners are comfortable sharing their opinions and asking questions. Accountability means that researchers should put processes in place to make sure that the research team stays accountable for upholding the principles of engagement. They should continuously make sure their actions are in line with the principles of engagement and that they are staying committed to the community partnership. The Aspire Network is a group of researchers and autistic people that create participatory research focused on supporting autistic adults, but they provide some information specific to engaging autistic community partners. For example, researchers should use appropriate accommodations to make sure people understand activities and can participate fairly. To truly partner with autistic people, the team should make sure their communication, sensory, executive functioning, and other needs are met in project activities. Researchers should also get feedback throughout the project about partner satisfaction and update their procedures to make sure everyone is satisfied with their participation. The team should also provide opportunities for partners to participate in desired tasks. You can check out more information about principles of engagement in our additional resources. Section 2, Centering the Experiences of Autistic People and Caregivers. In this section, we will discuss the contributions of different community groups to autism research. Autistic adults provide information about the lived experiences of autistic people. They are the experts on the experience of being autistic. They can give us insight about how autistic children may be experiencing the world and important skills that early childhood therapies can target to support autistic children as they age. For example, Many autistic adults have anxiety disorders, so perhaps early childhood therapies should target coping and self-advocacy skills or other skills that will prevent these disorders from occurring in the future. Many autistic adults also participated in therapy as young children, so they can tell us about the long-term impacts of therapies too. Some people claim that autistic adults cannot give fair input about early childhood therapies because these therapies may have changed since autistic adults were in these therapies. But it's usually unclear how some popular therapies have changed and if they've changed in ways that are acceptable to autistic people. Including autistic adults with experience participating in early childhood therapies can provide us with insight on long-term impacts of early therapeutic experiences and how therapies may need to change to be more effective. Some also say that autistic adults can't fairly represent the autistic children currently in early childhood therapies because we don't know if those children will grow to have the same strengths and areas of challenge as autistic advocates. But autistic people know more than non-autistic about the experience of being autistic. And many autistic adults did have the same challenges and strengths as autistic children currently have. There should be more efforts to include autistic people of wide-ranging strengths, skills, challenges, and cultural backgrounds in participatory research to ensure these efforts are as representative as possible. Caregivers must be included in autism research for many reasons. Caregivers are key decision makers for their child's care, and they can give us more insight about their child's unique strengths, challenges, and social contexts. Additionally, early intervention systems prioritize family-centered practice. This means they focus on helping caregivers understand their child and support their child's development. In this way, caregivers are also a recipient of care in EI systems. Their priorities and preferences must also be considered when designing interventions and related research. Autistic caregivers are often not considered in research, but they can give researchers unique insight. They can tell researchers about their personal experiences with autism. They may also have a unique understanding of their child's needs because they share a neurotype. Autistic caregivers also have unique experiences managing their needs while supporting their child. For example, an autistic caregiver might be sensitive to sound, while their child enjoys loud noises. This can be a challenge that other caregivers don't have. As we reviewed in the previous module, many people have been excluded in autism research. Some of these groups include Black, Brown, and Indigenous people, and other people of color, girls, women, non-binary and transgender people, people with co-occurring medical conditions and intellectual disabilities, and people from poor and working class families or with diverse family structures. Researchers should prioritize people from these groups to make sure that they can have access to acceptable supports. This will make autism supports more equitable and acceptable to all community members. Priorities may vary for different groups of people because of their culture, knowledge, medical or safety needs, and more. For example, many people want more acceptance of communication with AAC instead of speech, but some community members may prioritize research about speech because they cannot afford an AAC device, or they may want to avoid stigma associated with AAC in certain settings. We can continue to increase access and knowledge about AAC to address these concerns while still researching therapies for spoken language to meet the needs of community members with these concerns. If you would like to take a break, this is a great place to do so. Section 3, Inclusive Language and Framing. In this section, we'll discuss terminology choices researchers can make to be more inclusive and the mindset required to create truly inclusive research. There is a big debate about the terms to use when talking about autism. There are two types of language, a person-first language and identity-first language. Person-first language is describing someone as a person with autism. Identity-first language is describing someone as an autistic person. Person-first language is often, but not always, preferred by caregivers and has been taught to many doctors, therapists, and teachers in their training. Some people like person-first language because it encourages people to see the whole person and not focus on autism. This can be helpful in situations where autistic people face bias, but it doesn't reflect that autism is an important part of someone's identity. Identity-first language is often, but not always, preferred by autistic people. Autistic people may prefer it because it shows that autism is an important part of their identity and way of being. But it may cause some people to see autism first and not acknowledge a person's unique preferences or needs. Using preferred terminology is a sign of respect and acceptance. You can find more information about terminology choices in the additional resources. But using the right term is not respectful when saying something rude, demeaning, or ableist. Researchers must also think about autism in an inclusive way to make research more helpful for all autistic people. Researchers should think about neurodiversity and the social model of disability in their research about autism therapies and supports. Neural diversity teaches us that autistic people have unique ways of thinking and being. The social model says that autistic characteristics are not inherently bad, and we can change the environment to help autistic people succeed. These ideas will help researchers identify autistic people's strengths and challenges and design therapies that will work for them in the real world. So, researchers can ask themselves questions like, is this therapy trying to make anyone act less autistic? How can we change the environment to help autistic people with this challenge? Do autistic children develop this skill differently than non-autistic children? Researchers should also remember that research priorities may change over time. Autistic people's needs might change as culture, education, and healthcare systems change. Researchers need to remember how these systems impact therapies and what people need from therapies. Researchers should also avoid a one-size-fits-all approach to developing therapies. They cannot assume that each child and family wants and needs the same thing. Therapies need to fit each child's unique needs and strengths. Researchers should use methods that allow them to look at this uniqueness instead of assuming that their entire therapy should be used as is with each child and family. Partnering with members of the autistic and autism communities from multiple intersections of identity will help research represent the wide-ranging needs of autistic people and their families. Section 4. Community-driven relevant research. Community-driven research should address the needs and preferences of community members. It is possible to embed a community perspective in all kinds of research, but there are some specific research methods that focus on the role of community members more than others. In this section, we'll talk about two frameworks for creating community-driven research: comparative effectiveness research and patient-centered outcomes research. Comparative effectiveness research is a kind of research that compares therapy options to help community members make decisions. It explores positive and negative effects of therapy options. For example, a comparative effectiveness research study may allow us to answer a question like, which is more effective for supporting autistic children's communication, modeling, or prompting for language. And it can look at the impact of these strategies on multiple skills to help us understand if these approaches affect development in unintended ways. We can take this approach one step further towards being inclusive by making the study patient-centered. Patient-centered outcome research is a term used to describe research that focuses on questions and outcomes that are relevant to the community and that can be used to make healthcare-related decisions. Although autistic children are not automatically patients with an inherited medical disorder that needs to be cured, the general research framework of patient-centered outcomes research can be applied because this type of research can be used to determine the best ways to support autistic children and to help caregivers make decisions for their child. We will refrain from using the term patient-centered to prevent the potential stigma this could cause in the context of autistic children's development. But we wanted to familiarize you with this term because it is often used in more inclusive participatory research conducted in other fields. Putting it all together, comparative effectiveness research compares the benefits and harms of different therapies for autistic children and families. Doing CER in a patient-centered way through patient-centered outcomes research makes sure the therapies we research are relevant and important to the community and that we look at the benefits and harms of these therapies on outcomes that are important to community members. In our previous example of a comparative effectiveness research study, we can also make sure the study is patient-centered by making sure that the strategies and outcomes are important and relevant to autistic people and caregivers. Modeling and prompting are commonly used clinically, and many parents try to use them with their child. So caregivers might find these therapy approaches important to study. Not all autistic children have challenges in the area of language development, but many in the community report that this is a challenge for autistic toddlers, making language development an important outcome to measure. Many have reported that the child's independent participation in daily routines is important to them, and that too much prompting may reduce their independence. So, we can measure the impact of modeling and prompting on a child's independence to understand if prompting really does have a negative consequence. So far, we've talked about what research is, the history of autism research, and the importance of creating ethical and inclusive research. And we've discussed that research frameworks like patient-centered outcomes research can help us ensure that research is relevant to the autism and autistic communities. Next, we'll talk about how to develop a research question. This resource is part of a project funded through a Patient-Centered Outcomes Research Institute, Eugene Washington PCORI Engagement Award. Here's a list of the references used for this module. This concludes Module 2.